Hi, this is Dr. Mercola, and today I'm joined with Dr. Phil Harrington, who is a chiropractor by training, but in a prior life, he was actually a teacher of physics and math in high school in Iowa, and he brought that experience to his professional work in chiropractic and developed and worked on a treatment of laser therapy. And maybe some of you have heard of that, but it's really an interesting form of therapy that has a number of novel benefits that we'll be discussing shortly. Welcome and thank you for joining us.
Well, thank you. Lasers are classified according to their power output. So we talk about a Class 3A, a Class 3B, and a Class 4. Now, a Class 3A laser is up to 5 milliwatts of power. A Class 3B...
And a Class 3A would typically be a
laser pointer.
Laser pointer.
Yeah. With the 3B lasers, you're going up to half of a watt or 500 milliwatts. And then any laser that is more than half of a watt is a Class 4 laser. Mm-hmm. So let's talk about the importance of power when it comes to laser therapy. Power is measured in watts, and you can think of it as the brightness of the lights, mm-hmm. like the lights around us. So a higher powered laser is a brighter light, and it can produce more energy per unit of time. So that when it comes to doing laser therapy treatment, that gives us two benefits. Number one, it means that we can apply a therapeutic dosage of laser light to a much larger volume of tissue in the patient, but then also by shining that brighter light at the surface, we can get photons of light deeper into the tissues, so we can treat those very, very deep-seated pain conditions.
Well,
basically, three things are happening when we do a K-laser treatment. Number one,
or more generically, any laser treatment.
Any laser treatment.
K-laser just happens to be a really potent and effective one.
Yes, yes. Well, your effects with laser therapy treatments are to reduce pain, reduce inflammation, and enhance tissue healing. Mm-hmm. And that could be whether it is soft or hard tissues in the body, mm-hmm. muscles, ligaments, or even bone in the body. Laser therapy is proven to help to do with all of those conditions. But then when we look at the basic mechanism of how it works, we are enhancing the microcirculation. So we are getting more red blood cells flowing to the area, but then it's not just the arterial blood supply to the area, we are enhancing the venous and the lymphatic return from the area. Then we are also increasing oxygenation of those tissues. We are stimulating the hemoglobin molecule to dump off oxygen at the treatment site, so we are increasing the oxygenation of those tissues. And then finally, we're stimulating the cytochrome oxidase enzyme. And this is really one of the key discoveries in the whole science of laser therapy and the mechanisms of action, is that the cytochrome oxidase enzyme in the mitochondria, inside of the cells.
And these are in all cells.
In all cells,
and
right.
Specifically, you're targeting the injured cells.
Yeah, and that's an interesting aspect of laser therapy, is that those injured or damaged cells are more readily accepting of the photons of light. They will absorb them more than normal.
Because a healthy cell doesn't need the extra energy. It's sort of optimized and balanced, and it's humming along.
Exactly, yeah. So that's by stimulating the cytochrome oxidase enzyme, we are utilizing that oxygen in the respiratory chain inside of the mitochondria, producing more ATP for that cell. So like you say, regardless of what kind of a cell it is, it's going to function at a higher level. Now, we are not turbocharging. We're not making the body do anything that it could not normally do. Mm-hmm. We are just facilitating the process. We are helping those cells produce the energy that they normally would, so they can function as they normally should.
Well, and let's also clear up some potential confusion in that, because especially since this is a high-powered laser, mm-hmm. lasers are also used in other areas of medicine, specifically in surgical interventions, where they're used for cutting or removing tattoos, or a lot of other dermatological applications. So can you differentiate because this doesn't do that?
Exactly right. The interaction that we're getting with the body, with the K-laser, it's called a photochemical reaction. By shining that light on the tissue, we are getting that ATP energy produced. Whereas your surgical lasers, your hair removal lasers, your tattoo removal lasers, they are designed to cut or ablate the tissues.
And again, your laser is about 15 watts, and the ablative ones, the ones that actually do surgical cutting, are closer to 100 watts.
So one way that it's used is together with some of the various soft tissue mobilization techniques, whether it's active release technique or Graston, where they're using the Graston tools, the instruments, mm-hmm. To work on the soft tissue, or if it, just generically some of the PNF type of stretching. But yes, we always want our doctors to do the K-laser treatment before they do those soft tissue techniques. Another technique or modality that it's used together with is spinal decompression. So when a person has a bulging or a herniated disc, by running the laser on the low back, we are reducing the inflammation internally, we are reducing the kinins, the tissue irritants in the body, and we are helping to stimulate the blood flow in the area to help that decompression treatment help to heal up that damaged disc. Another interesting area, and this is one that we're just at the forefront of it here, is both human and animal practitioners using the laser together with either the platelet-rich plasma injections or with stem cell therapy. And that's, we're just at the beginnings of discovering the benefits of those things together.
And I wonder if you could maybe give some simple examples of people who have been treated or types of injuries that people improved upon.
Okay, so in the chiropractic office, it's going to be a lot of the acute injuries, whether it is a strain, sprain, a shoulder injury. It could also be some of the repetitive use injuries, such as carpal tunnel syndrome. It could be traumatic injury, whether it is a post-motor vehicle accident with the cervical strain, sprain. Also getting into some of the more chronic issues, whether it's a frozen shoulder or arthritis, knee arthritis, hip arthritis. It can also, one interesting aspect of it as a modality is that it can be used over metal implants. And everyone who uses the K-laser has their own top 3 or top 5 treatments that they do that they are very satisfied to help that patient.
Do you think that it would be reasonable to seek someone who has a higher level laser therapy available at the 15-watt level or so,
yes,
and to provide that as an alternative to going to essentially irreversible surgery?
Yes, and that's, once again, the class 4, the K-laser treatments, it is amazing in that they are so effective at treating a wide variety of conditions, whether it is the soft tissue injuries, the acute injuries, nerve damage. For example, we have a gentleman from the Twin Cities who was so successful at treating diabetic neuropathy that he has franchised a chain of treatment centers where they only treat, the only condition that they treat is diabetic neuropathy, and the K-laser is a keystone in their treatment plan. So K-laser treatments, virtually no side effects. And when we talk a little bit about how the laser works, one effect that we're getting is vasodilation of the tissues. Also, a lot of release of the tissue irritants in the area. So that if we're treating a patient that has a lot of myofascial trigger points, a lot of gunk, a lot of garbage in their muscles, a lot of metabolic waste products, and we give them a K-laser treatment, a couple of hours afterwards, they might be a little bit sore, and it's absolutely not any tissue damage going on. It is because we are causing the release of all of those metabolic waste products that were locked up in the muscle.
Maybe you could address the FDA issue.
Okay, all therapy lasers are FDA cleared medical devices. And yes, the K-laser is FDA cleared. One interesting thing about the FDA clearance is they really do not recognize the biostimulatory effects of laser therapy. They see it simply as an infrared heating device.
Okay.
So when you look up the FDA clearance for the K-laser, you will see that it is a infrared lamp for topical heating for temporary relief of muscle spasms or joint stiffness or that sort of thing.
And they allow you to say the other benefits that it produces? Because typically when we try to do that, even with something as simple as supplements, which is obviously not a medical device, they like to write us letters and shut us down. So we're really careful about them. We don't say them.
Right,
so
exactly.
Even though it's truthful, they do that. You have to add these specific prohibitions which prevent you from doing that.
Right. Well, yeah. Virtually any condition that we treat has pain associated with it. So
okay. This is not something that is really designed for the average user. This is really for a healthcare professional who's trained in it. How long does it take to get for the healthcare professional to understand how to use this properly?
Yeah, so with the first point, the FDA clears devices as either over-the-counter or prescription medical. So there are a couple of lasers out there that are over-the-counter, which means that anyone can buy them, while they're very, very low in power. The K-laser is a prescription medical device sold only to healthcare practitioners. So as far as training someone using the machine, we give them all of the scientific information in what we call online modules, where they sit and watch laser therapy science, physiology, and safety, after which they take a certification exam. We also supply different training materials, whether it's booklets or DVDs or webinars.
How long does that training occur? take?
Well, to sit down and do the modules, it's about a 3-hour process. And then when someone does buy our unit, we do come to their clinic and give them, typically it's a 4-hour training session, so that we go through how to use the machine and how to treat different conditions.
And so once the clinician has the machine and is properly trained, how long does a typical session last? And is it dependent upon the type of injury or the pain the patient has?
It depends a little bit on the body part that we're treating or the condition. So your shortest treatments could be some of the jaw issues, or something fairly superficial, treating a fairly small area. That would be 3.5 minutes. And then on the other side of the spectrum, if we are doing either a disc herniation or diabetic neuropathy, where we're wanting to treat the low back and all the way down the leg, that could be 12, 15, 20 minutes of treatment time.
Okay, and then I know this is also likely vary upon condition, but how many treatments are required before the actual condition is resolved or the pain is relieved?
And that's always an important discussion to have with the patient in your consultation, because one of the first things that will happen, whether it's in 1 to 3 treatments, their pain will drop dramatically, say from an 8 to a 2 on the pain scale. So we need to educate the patient that the absence of pain does not equal the presence of health. Even though we've done wonders to remove the pain, there are still underlying tissue damage that does need to be healed up. As you say, depending on the condition and the nature of the injury, but the vast majority of conditions, 6 to 12 treatments over a 2 to 4 week period of time, we can get some pretty good resolution of those conditions.
So if someone is motivated to have this type of treatment and seeks out a clinician, what type of price would they expect to pay? What's the range that is typically charged for this type of service?
The range for this type of treatment with the K-laser treatment is from about $40 to $150 or $175. So in that range, but when you analyze everything, when you look at how it's an effective treatment, which can give you help, virtually no side effects, it is well worth, it's money well spent.
Yes,
money well spent.
it would
Yes.
certainly seem so,
Yes.
considering the cost of the alternatives, not only the physical cost that you're paying out of pocket, but the mental, emotional, and the side effects that one can endure and suffer as a result of electing to choose a more traditional approach.
Right.
So I would assume that there are a list of clinicians who are trained and certified and have this resource available. Is it on your website? Or?
Yeah, it's on our website. It's k-laserusa.com, k-laserusa.com. And in both the upper left and upper right-hand corner, we have links to find a provider.
Okay.
And on that page, we have both human medical and veterinary medical providers.
Now, interestingly, and perhaps not surprisingly, a large percentage of our viewers have pets. So if they have a pet, what type of conditions would a pet benefit from? Same ones as humans?
Okay.
Or any other condition?
And actually, it's going to be an expanded list, because veterinarians are able to use medical devices as they see fit. So yes, it's going to work for any of the arthritic conditions, hip dysplasia, intervertebral disc disease, endoxins. And looking at the little dachshunds that where the pet owner had brought them in, planning to put them down because their back legs were useless, get a few K-laser treatments, and the little dachshund is up and running around again. Some of those stories are really heartwarming.
Well, it certainly seems like a useful strategy to approach if you struggle with some of the conditions you make it, and it seems worthwhile. So thank you for coming and sharing this interesting technology with us.
You're welcome. Thank you.